Bilal Irfan, who is one of the authors of the Lancet's report on antibiotic-resistant diseases in Gaza, and he joins us live now. Welcome to the program. Great to have you on. So Gaza has recorded the first case, Bilal, of a child dying from Guillain-Barré syndrome, which is a rare neurological disorder that presents symptoms that are similar to polio for people that aren't familiar with this. Just tell us a bit more about this disease and how concerning this is for you, given that this is happening in Gaza right now.
Yeah, absolutely. Thank you for having me, Maria. I think one of the really important things to keep in mind in this context is that GBS, the symptoms can sometimes show up in a few hours. Sometimes it can take weeks. The way that we kind of can assess this. And again, one of the other, this disease is, it's really hard to test for it. And it has symptoms that may be similar to other diseases as well and other conditions. So there's not really the proper equipment required to test for it in Gaza specifically. So sometimes clinicians are kind of diagnosing this based on a suspected case of GBS, based on commonly presenting symptoms. And this can lead to paralysis. This can sometimes lead to death. I know in many cases, there's a substantial rate of people who eventually the muscles are weakened so much to the point that they do require mechanical ventilation, which is obviously in extreme scarcity in Gaza. So the consequences are quite grim. And I know there has been a little bit less than 100 cases that have been, somewhere over 70 at least, that have been recorded since early June by the Palestinian Ministry of Health and by the doctors in Gaza who have been raising the alarm about suspected GBS. So this is definitely a cause of concern. And it has to be kind of viewed in the context of the wider spread of infectious diseases, the wider spread of disease outbreaks and contamination and whatnot in Gaza.
And Bilal, of course, you're using the acronym GBS, Guillain-Barré syndrome. Just help us understand how it's spread in Gaza. Abdul Wahab, our colleague there on the ground, was saying that, of course, there's roughly 1.2 meters squared per person in some of the areas where people are displaced. So just that overcrowding, as well as all the issues that we're reporting on, that the starvation, the lack of hygiene as well, and sewer issues contributing to this.
Yeah, absolutely. I think one of the important things to keep in mind with GBS is how little we know about it and how hard it is to treat it. We don't really have a perfect, well-established way to perfectly treat GBS at this point. And then I guess one of the other issues that are presenting with that is we know that GBS is usually preceded by infection in many cases. And so it's really hard to pinpoint sometimes if that infection is going to downstream lead to a GBS case. And in some cases, people have had COVID-19 and downstream there has been reports of GBS. So it's really hard to make that causative link really easily. But what we do know is kind of the way that any of these social or like physiological determinants of health are going to kind of manifest is when you have a weakened immune system, when you have malnutrition, when you have people who have hardly eaten in days, if not morsels of food, you don't have regular healthcare. Primary healthcare is completely decimated in Gaza. People are not going to go get their regular checkups. Infectious disease is so widespread and actually quite underreported, likely. In that context, we should not be surprised when things like polio have reemerged in Gaza as of last year, and now that there's suspected cases of GBS. So it's unfortunately just another part of the Israeli strategy of blockading Gaza and denying medical supplies, and one of the other ways of destroying the health system and making life in many ways unlivable in Gaza for the Palestinian population.
Bilal, what are your biggest concerns given the spread of these infectious diseases right now, which are resistant to antibiotics, spreading in Gaza, given the conditions, the lack of hygiene that we've been speaking about, the overcrowding as well?
Yeah, absolutely. So, I mean, that recent report in the Lancet infectious diseases that highlighted that there was almost about a 2/3 of the study sample size found multi-drug resistant bacteria, and about 3/4, I think, in a really important point to keep in mind, 76% of that study sample involved cases coming in from trauma and wound cases. So obviously, when there's infectious diseases or when there's surgeries, which we know from clinician testimony and other studies that there are fracture-related infections happening in Gaza, that requires antibiotics to treat it. But then when antibiotics have been completely halted alongside chocolates and anesthetics and very basic food and medical supplies from entering Gaza, you're relying on the same scarcity if you're able to first procure an antibiotic, which in many cases people are performing surgery, surgeons are holding down people without anesthetics and without proper antibiotics and performing surgeries on them. And again, when you don't have antibiotics, you're not able to properly treat for these infections, and it's going to lead to this sort of multi-drug resistance. So it's in some ways it's completely expected to happen. But I guess one really important point to mention, though, is this is not necessarily fully new to the context of Gaza. Multi-drug resistant bacteria in Gaza was prevalent even before. And this is because of Israel's blockade in this current genocidal policies that Israel has implemented in the Gaza Strip. It should really come as no surprise that infection is one of those things that are going to be spreading.
Bilal, thank you very much indeed. Bilal Irfan, infectious diseases researcher, thank you so much for your time and sharing with us that first-hand reporting. Thank you.